is mild asthma and which are the risks?
Well, the definition of mild asthma has been changing depending of the task force. It may change in the future, but up to now, mild asthma has been considered a patient with a proven asthma that has minimal symptoms, let's say no more than twice a month, or no exacerbations, or very few. In fact, in the past, if they were requiring a mild dose, a small dose of inhaled corticosteroids only, they were considered mild. And if they had no need for such medication, this has changed recently, they were considered very mild. The many studies done in the last 20 years have shown that even mild asthma can be deadly. In fact, we think that about a third, if not more, emergency visits for asthma are in so-called mild asthma, and in fact up to 10-15% about of asthma death have been reported in mild asthma. So this is really significant. And of course, in regard to the triggers, many triggers can be responsible for an asthma attack or an asthma exacerbation, we should say, like allergen exposure, viral infection, pollutant exposure, high pollutant exposure. So these are all factors that can trigger an asthma exacerbation.
Which are the two preferred controller options?
In regard to the controller treatment, which is a medication that has a role to control, to minimize symptoms, minimize rescue medication needs, and prevent exacerbation, which is in fact the definition of a controller. Inhaled corticosteroids are the best treatment as a controller. Of course, if it's not sufficient, we can have long-acting bronchodilators mainly, and also additional drugs such as leukotriene antagonists and anticholinergics. And for the most severe asthmatic patients, we have now a variety of biologic agents that can be helpful. In 2019, it's just amazing that there is a lot of death. There are a lot of deaths due to asthma. According to the statistics, it can achieve a few 100,000 a year, almost 500,000, which is just amazing for a disease that should be controlled in most patients, in most people.
What is GINA, or Global Initiative for Asthma?
The Global Initiative for Asthma, called GINA, it's often called GINA guidelines, but it's not a classical guideline. It's mostly a strategy for the clinicians. This is an initiative that started with the World Health Organization and the US NHLBI about 25 years ago, because at that time there was an epidemic of death and mismanagement of asthma, and people considered that we had to know more about what is the optimal treatment or management of asthma. So in the last 25 years, GINA has produced a yearly report on what is considered the best way to treat asthma of different severities.
What's new in GINA 2019?
In 2019, there has been a major change in the suggestions for management of mild to very mild asthma. Basically, GINA has proposed that combination therapy with an inhaled corticosteroid at low dose associated with formoterol, which is a fast and long-acting bronchodilator, on demand could be used to try control asthma in this population. In the past, of course, it was either for very mild asthma, a beta-2 agonist on demand alone, or for mild asthma, a low dose of inhaled corticosteroid plus short-acting bronchodilator on demand. But of course, due to the very poor adherence to the treatment in these patients, and often the risk of abusing the beta-2 agonist, now this is no more recommended. We recommend, in fact, the combination therapy on demand that I just mentioned.